sisemi. Na sisi tunaringa kwa sababu ni waziri. Hapana. Natumia tu kama nini? Mfano. Wengine wataanza kuargue hapa. Ati kitu ibaki tupambane mpaka vile tunamaliza. Ni kwa sababu wako na pesa. Wanaweza kujipeleka wapi? Ng'ambo, waende Eldoret, waende Kenyatta University level 6 ama Kenyatta Hospital. Mtu wa kawaida ule mama mboga mwenye anauza hapo kusoko atawezana na hiyo cost ya hiyo operation kwa private hospital Eldoret ilikuwa almost 600,000 na ilikuwa tu siku 3 peke yake. Wakati hata wewe ambao mmekaa ungeweza hiyo 600 wewe ungeweza naye. Kwa hivyo tafadhali, what we are looking for is service to the common person. Kama unataka kupingana, mbona nilitolewa Kakamega nikapeleka Eldoret? Mbona sikwenda hapa CGH? So tunataka watu wetu badala ya kung'ang'ana, wanasukukana, wanakufa kitu ambao wangepona, wanapelekwa Nairobi, wanapelekwa Eldoret, wanaenda South Africa, wanaenda India. Hivi vitu yote ifanyikie wapi? Hapa hivi. Sasa wewe fikiria, uko na shamba, watu wengine wanapanda miwa, wanavuna, wanapata pesa. Wewe una uwezo wa kupanda miwa, ama umepanda miwa, uwezi ukapalilia, uwezi ukaweka mbolea. Mtu akuja aseme nataka kufanya nini? Kulisi hiyo shamba, na nitakupatia hii pesa, na ulikuwa umeshindwa, utakata? Hii ndio mpango ambao tuko nayo na national government. Na lawyer amewasomea, amewambia there is a clause in the constitution which says county governments can give national government certain operations kufanya on their behalf, kama itakuwa to the benefit of the local person or the poor person. Na ndio tumefanya hivyo. We are not losing the facility inabaki hapo, but we are telling the government, maliza watu wa nchi, wananchi wa Kakamega na zile viunga vyake waanze kupata nini? Huduma. A good example is Nyeri. Juzi mmeona Uhuru Kenyatta, Mheshimiwa Uhuru Kenyatta akienda kufungua. Nyeri ilishindwa na wamekuwa kwa serikali hii miaka yote. Wenye wanarani Kenya ni Wakikuyu, wanatoka wapi? Hizo para za Nyeri. Na walishindwa. Wakapatia national government. National government ishamaliza, ndio hao washaanza kupata huduma. Wana watu wa Kakamega wanataka kuleta siasa ndani. Mambo ya health, tafadhali tusiweke nini? Siasa. Pata huduma, ishi maisha bora, ishi maisha marefu. La mwisho, the next town in Kenya who was city, whether you want it or not, ni gani? Sio Kakamega bado. It's Eldoret. Mtu anasema the right thing. It's Eldoret. Ask yourself, why is Eldoret growing so fast? Ni kwa sababu ya Moi Teaching and Referral Hospital. Because once Moi Teaching and Referral Hospital ilianza, so many other hospitals za kuservice hiyo zilianza kutokea. Na hizo hospitals grow, wateja wanakuwa wengi. Inaitwa medical tourism. Haya, nyumba zinaanza kujengwa, mabarabara zinaimprove, watu wanaongezeka. Sasa inataka kuwa city. Kakamega kisi tunataka kuwa city. So one way of hastening development ni kumaliza hiyo hospitali. Na ikiisha, wale ambao mnajua mambo ya development, spiral effect is what is going to happen in Kakamega. Sooner than later, unasikia Kakamega is what? The next one after Eldoret. Kuna zaidi ya kuongeza. Kama kuna swali uliza. Asante.
Sasa ni wakati wa maswali. Wakati wa maswali, nafikiri nitaanzia pale nyuma. Unataja jina lako, mahali umetoka na swali.
Jina langu ni mimi ni Musa Kakamega, nakaa hapa Kitao. waziri ametuelezea kwamba kuna level 6 hospitals in quite a number of areas in this country. Ningependa kuanzia, swali yangu ya kwanza ni kwamba kwa hizo hospitali ni gani imetumia pesa za county kujengwa? Hiyo ndio swali yangu ya kwanza. Kama kuna yeyote among them ataniambia. Swali yangu ya pili, tuko na 3 levels kwa hospitali ambayo tunajenga hapa. And we have done level 1, we have only 92%. What does level 1 consist of? And what does level 2 consist of? And what does level 3 consist of? We need to know, because if you finish this hospital by levels, we will get this thing done. 2, we are not saying that the national government, the hospital should not be taken to the national government. That's not what we are saying. We are saying that what are the reasons why we are giving it to the national government? We would like to contribute to that so that we know whether or not it's prudent for the hospital to be surrendered to the national government. This will be a second project in Western, which has been given to national government, which was a local project. Weko is one of them. Weko was given to the national government. It was our local project. Now, the hospital is being given to the national government. It is still our local project. So, I think I want to get those answers first. I can continue.
Yeah. Any other question? Hapo katikati. Nafikiri alikuwa kaeleza lakini atarudia.
Yeah, thank you very much. My name is Kakamega from Shirere. Maybe I use the language which is common to our fellow men here. Ya kwanza is to thank the county government for this initiative to make sure that we are here together so that we can soldier on. Mimi nachukua hii nafasi kusema kuwa hii county, hii hospital ikienda kwa government, it will give us a lot of benefits. Kwa sababu ya kwanza, hata Weko wakati ilienda kwa national government ikaitwa Masinde University, hata nyinyi wote mnaona benefits. Kauni imekuwa sana kwa sababu ya hiyo. Kwa hivyo kuwe sure tunataka kuona maendeleo kwa hii area yetu. Nyingine about source, tunaongea kuhusu hii fund ya county government. But naona kuna mahali kuna kama coalition about gift. Kwa sababu muongea kuhusu donation, other things. So I was asking, mbona mjaweka gift kama part of it? Kwa sababu kama fund inapata gift ya kwenda kufanya kitu fulani, what happens with that? Another thing is about when you transfer hiyo hospitali, which is a good thing. Tuko na watu hapa wetu wenye watataka pia kupata kazi. Hiyo hospitali ikienda kwa the national government, our able minister ametuambia kuwa kuna ile vitu tunaweza share na national government na tunaweza share pia functions. So I was requesting, wakati tunaenda kukaa chini, kuna function maybe government watataka kuchukua wafanyikazi fulani, na pia sisi county tuambie national government kuna kada ya wafanyikazi fulani haifai inatoka kwa national government, itoke hapa waandikwe hapo kazi. Another benefit, members, nataka msupport sana hii mjadala kwa sababu mimi nimekuwa na baba mgonjwa, na kabla ya aje tulikuwa tunasumbuka sana kumpeleka Eldoret kila saa, na ukipeleka mzazi Eldoret unapata unaenda hapo siku mbili, mwingine anaenda siku mbili. Sasa expenses inakuwa mingi, si transport si nini kwenda mbali. Lakini tukisema hiyo hospitali hapa, mtu anaweza tembea kutoka kwenye mimi na kwa mguu polepole anaenda kuona mgonjwa wake. Kwa hiyo machache nasema asante.
Asante sana. Yes. Hapa mbele. Nafikiri tutapanga swali hapa na pale, then waziri na respond, then we get another set of questions.
Asanteni. Natumia Kiswahili. Mimi naitwa Vincent Kabole Kwangu kutoka Ikolomani sub county. nashukuru afisa wa Lincoln bila imeeleza kuhusu mjadala huu. Nashukuru tena minister bila imeeleza. Mimi kama delegate naunga hii mswada mkono kwamba national government ichukue hiyo hospitali, na naunga kwa hii point. Ni vizuri kukuwapo na kitu chenu ambacho mnajivunia kama wana Kakamega, na kusema ukweli, national government ikichukua hiyo mradi ita with modern machine, with professors ambazo sisi kama counties hata kuwalipa maprofessors. Lakini ombi langu ni hivi, saizi wananchi wana complain ama wanalalamika kuhusu hospital bills ambazo ni mingi ama ni kubwa kwa referral yetu bado tunaiye Kakamega. Wananchi wanalalamika of those high hospital bills, and bills of studies iko juu sana. My worry is, as we sit on the table with the national government, let this not be another burden. Hiyo studies ikuwa burden tena, whereby wananchi wakuwa wasikuwa na uwezo wa kuafford ama wasikuwa na uwezo wa kugharamia bills of study kama matibabu. Si vizuri kukuwa na hospitali mzuri, lakini sisi wenyewe wananchi kwa sababu ya hali yetu ya kifedha tusiweze kuafford ama tusiweze kuhudumia mahali pale, labda hatuwezi afford the bills. So vile tunakaa na national government, after finishing the facility, let us have favorable charges, CT scan and all those things. Let us have favorable charges. Alafu
Jaribu kusummarize. Yes.
Alafu ya mwisho ni kwamba waziri ametoa kwamba 12 billions ndio zinatakana 30 billions zinatakana kumaliza na mambo ya operation and so on. Nakumbuka hiyo hospitali ambayo tunaita Kisumu referral to Russia, walipata donor ambao aliwasaidia wakamaliza hiyo hospitali. Hata sisi Kakamega hatuwezi donor ambao kusaidia sana kumaliza hospitali yetu, na tuchukulia hospitali kama Kakamega level 6 hospital, after kupata donor mzuri ambao atatumia kwa bariki.
Sijaona mama, hakuna mama anataka kuuliza swali. Okay, mwisho kijana.
Kwa majina ni Rafael Golwe Nabai kutoka Mwisero, Kisa East Ward. Mengi yameongewa, watu wameongea. Sisi ama mimi kama yule ambaye ametumwa hapo kuwakilisha watu wa Mwisero, ningependa kuunga mkono kwa dhati kusema ya kwamba hii facility kulingana na faida ambazo tumeambiwa, na kweli faida hizi ni za maana mno, na unga mkono ya kwamba serikali kuu ichukue hospitali hii ikaweze kuendeleza, na ni kwa sababu ya faida ambazo tumeambiwa. Swali pengine ningetaka ama challenge ni kwamba next time serikali ya kaunti ikitaka kupanga mipango kama hospitali kuu, ni pesa nyingi sana za kaunti ambazo zimeenda kujenga hiyo. Pengine hizo pesa kama zingetumika mwanzoni kufanya miradi mingine, tungekuwa na miradi mingi sana. But anyway, all in all, wacha facility hii ichukuliwe na serikali kuu. Mimi kama mwananchi wa kawaida najua kwamba itafaidika. Mimi kama kutoka Kisa East, mahali ambapo the immediate former majority leader ametoka, tunaunga mkono.
Huyu anaongea kama mtu wa roho, sio? Sasa mama ndiye atafunga hii kipindi ya kwanza. Naona mama mmoja hapa mbele na mwingine nyuma. Na tafadhali kama uko na maoni the same, tawachia pale. Kama utakuwa na different, ndio utapiga mkono uongeleshe. Sasa yes mama.
Amjamoni. Kwa mjana mwita Kakamega kutoka Visero, Kisa Central. Mimi wacha nirudishe shukrani. Vile niko hapa niko na mgonjwa Kakamega kwa saa hii. Amewekewa mpira na pesa hata yenyewe ya kuenda Kakamega haiko. Natoka Visero. Cha pili wanasema saa hii akuwa anapelekwa Eldoret. Napigiwa simu nikiwa hapa apelekwe Eldoret. Niambie mimi mwenyewe ikiwa sina pesa ya kutoka nyumbani kufika Visero. Sina ya kutoka Visero kufika hapa sina. Sasa Eldoret ndio nitapata? Siwezi. Tafadhali wacha tupitishe msaada swada ingie tupate level 6. Asanteni.
Kuna mama mmoja kule nyuma, alafu waziri respond, then tupate maswali kama tatu tupige kipindi.
Mimi ni Ann Alusa natoka King'elu. Sasa the Central Ward. Yale mimi sana nasema yote niunga mkono. Yale breaking this project. Lakini nawaelezea, before you make a budget, you must know what you have. Mnatengeneza budget kubwa hata imemchinda. Sasa mnalia neno. Ngoja neno likukue tengeneza. Ngoja mtaki. Kwanza ni nini kwa kweli?
Haya. Nafikiri mama amewachangamsha sana. Sasa tupate waziri export kwa hiyo maswali na comments, then we get another set of 3 na kufunga. Na nafikiri tutaanza na ule mzee amepata spot na white shirt. Sitaendelea kule. This other guy.
Thank you so much, Mr. Chairman. Now, give me maswali kutoka the latest rudi the player partners for engineer yangu ilikuwa mwisho. Now, let me start with Mama. Now, it's not that I want to defend the government, but let me tell you what I talk about Mama level 6. Si ati kwa walio kama kwa vitabu wanasema we have. Ili yani unataka kufanya kitu lenye unajua uwezi. Haipo hivyo. Tulikuwa na task force yenye ilikuwa set up na governor when he took over office. Maoni ya kutengeneza hiyo hospitali haipo ya governor kufanya. Ilikuwa maoni yetu. It was public participation. So mama, sahau. And let me tell you, for one ambao if you want and something better than if you get an A, you will get a B+. If you want to get a B+, you now have to aim at what? A. Now the issue was what Kakamega, Kisumu, Busia, Bungoma, mpaka Uganda, I want an 80 level 6 where they can get specialized treatment. Ilikuwa Nairobi, South Africa, India. And let me tell you, tunapata pesa regularly, ili ilikuwa kama na pia hiyo study question. Problem has been what I do. So this was one vision which was invented by the government. Unfortunately, it's going to keep us out. Now, the other question was, Russia is the partner donors. Russia is the source. It is so. In fact, it was the Russian government. But remember the dynamics at that time. We had the USSR and USA. It was a war. NATO versus what? The other was called Israel. Also part and the NATO part. So there was competition. It was really the Cold War. We are defining, we are not attacking. And remember, USA was fighting the Soviet Union because of Mamboya policy. Communism versus what? Democracy. So right now, we don't have that kind of thing. But to make a read so many times, and some of you are agreeing to this, we even have so many companies, foreign companies, ambazo nataka zikuja zimalize hizo hospitali. But you see, those are companies that are not giving free money. Wanataka ukiwapatia hizo hospitali, they run for some time, wa recoup their money, warudishe pesa yao, wapate profit, then they hand over. My friend, that's what you want. Now, once you give somebody a facility as a private facility, will you be able to control prices? You can't control prices. That's why we wait. In fact, Germany is very, very willing kumaliza hiyo hospitali. Lakini tukaangalia kati ya German government na national government, who will be more friendly? The national government, because national government takes care of your welfare. So that's why we opted for national government. High cost of treatment. Hiyo ni swali nje ya hii motion. But because waziri yuko hapa, what is the jibu? Now, level 5, which is the CGH, is supposed to be almost the last resort. I've seen the former chairman here, chairman wa hiyo hospitali. Pengine daktari simama tu watu wajue. Yeah, ndio huyo. Daktari with a lot of experience. Thank you so much. Now, let me not go into technical issues because hizo ni sio za mwananchi wa kawaida. Now, kukwenda CGH intakana uwe ushaanzia level 2. Level 2 ni dispensary. Dispensary ikishindwa kukutibu inakurefer to level 3, which is health center. Health center isipokuwa na uwezo wa kutibu ikurefer level 4. Now, level 2 na level 3 ni free. You are not supposed to pay anything. Free treatment. But in the event that they are unable to treat you, wanakurefer to level 4. Level 4 itakana ulipe, lakini sio bei ya juu. But by the time you are referred to CGH, unajua mambo inaharibika. Na hapo sasa unapata specialized services. Hapo mpaka itabidi ulipie. Na ile cost ya kulipia imeandikwa, iko documented. Na tena iko tu unaweka tu arbitrary no. Inawekwa kulingana na vile unataka kutibiwa. Level 6 will be even a little more expensive. Itakana uende huko kama level 5 umeshindwa. And by the time you reach level 6, jua it is almost 50-50. Daktari yuko hapa atakwambia. It is 50-50. You either survive or what? You go. So huko tu kwa cliff. Na hapo ndio matibabu inakuwa more expensive. Ladies and gentlemen, that is why Oparanyas government inajaribu ku expand services so that usije ukafika CGH level 5 matibabu ishetu hapa chini, unless itakuwa specialized kama hii mimi pata ama ile mama ameongelea hapa, itabidi wende level 5 ama level 6. Hivyo. Now, the other question was, mtu ameongelea mambo ya alikuwa sema ni kama ni pastor, hapo na sauti ya kutosha. Kuisema. Mambo ya equipment. Those who have been in the medical circles understand this concept. Sio kitu kama gari yenye unaweza kununua saa hii na ikaishi mpaka 15 years na bado inatumika, inatembea, inafanya kazi. Medical equipment inakuwa relevant for some time. After some few years, it is obsolete. So you either buy a new one or you look, because we don't want to lose focus, the vision. We don't want to lose the vision. Ukichukua mtu mwingine umweka kama chairman wa kwanza, does he or she know the vision? And so most likely the first chairperson atakuwa governor or parliament. You want to tell me maslahi yetu haitashughulikiwa? That is it. Now, mambo ya gift, I think what niwachie politicians, minister of the mtu aliongelea mambo ya gift. Oh, that time wacha nimaliza kwanza. Then I'll give you a chance something. Now, mtu aliuliza levels of the levels. Now that is engineering phases. What are the phases of levels? Unajua ukisema phases, there are only 3 phases hapa. Phase 1, phase 2, phase 3. Levels, anataka levels. No, levels. Now, level 1 ni wale ambao mnajua wanakaa kwa community areas, wanaitwa CHPs. CHP ni kujua mgonjwa yuko, aenda angalie, amu-advise, amwambie enda hospitali. But kuna ile ugonjwa very light yenye unaweza ukaangalia wakajua nini kitu fulani. Wako na madawa basics, daktari wa think cannot easily explain that basics yenye anaweza akapeana before akwambie ende upate wa the next level. Next level is level 2, which are dispensaries. Dispensaries are only allowed to manage certain ailments. And in like ailments, pengine wamepima, wamepata huko na malaria, na kupatia dawa, unarudi nyumbani. Lakini kuwa complex, kuwa complicated, wanakurefer to level 3. Level 3 is health center. Health center is more advanced. Health center utapata hapo what we call a clinical officer. Hakuna clinical officer, utapata nurses. And mostly, at most, 3 of them. Otherwise, utapata 2. And in some areas, 1. That's why there are complaints everywhere. Now, health center should be able to deal with it a certain level or offer certain level of services. Wakiona it's a more complex one, kama pengine mama ambaye anataka kufungua na ana require operation, then wanamkimbiza, wanamrefer kwa level 4. Level 4 is supposed to be well equipped, a very nice facility that can offer a wide range of services. Lazima ikuwe na maternity, then must. Itakani ikuwe na mortuary, must. Ikuwe na section ya watoto, wanaume, all those things are supposed to be offered. That's why unaona zinazidi kujengwa. Now, it is only when things are now elephant that unarefer kwa level 5. Unakaribia hapo ya 50-50. That is how it is, Engineer George said. Now, finally, which hospital ilijengwa na county money na ikawa handed over to national government? It is Nyeri. In fact, they were opening, I think, 2 weeks ago. Yes. Yeah, I think this month we will go to football. So we are not the first ones. We are, and there is nothing we are losing. In fact, we are going to pay. Now, perhaps, Mr. Chairman, with the permission, if you can allow Dr.
Dr. Who? Yes, proceed.
Kuniona. Mimi kwa majina naitwa Dr. Edwin Igao Angela. I'm a senior specialist I'm born in this county, and born in Kolomani, Kakamega South. Ushanga. Wale mnaelewa hii Kiluya yetu. Na mimi nimekuwa daktari kwa miaka 30, karibu 30. I'm the immediate former chairman of Kakamega County Referral Hospital. In fact, that chairmanship was appointed on the strength of this new hospital as a level 6 parastatal. Is that also Maurice? Was it? It wasn't realized, but that was my appointment, the last appointment I had. Kwa hivi leo nashukuru kuwa na nyinyi hapa, na ningependa masuala ya matibabu ama health mtoe siasa ndani yake. Wala anaenda MCA kwa county assembly kupitisha huu mswada, you must have information and you must seek for it. And the minister and the county must provide it so that you go the right direction. Otherwise we find ourselves as a county in a total mess. Jambo la kwanza, mimi nilikuwa mshiriki katika mipangilio ya kufanya ama kutengeneza hospitali. Vision, discussions, na governor's office, tulikuwa madaktari kama 15. Chairman wetu alikuwa Professor Kainga, ambaye asangina mtu mmoja kwa siasa. Mimi siendani siasa. Na wakati huo around 2014, after the first county elections were held, tukaitwa na governor, tukapanga mpangilio, tukachore michoro, tukahusika kwa mambo mengi. Kwa hivyo huu mswada kusema hospitali iende kwingine si mbaya, lakini nyinyi kama watu wa Kakamega mjiulize inaendaje? How is the hospital living as the central government? How is the vision still maintained? Is that vision we envisage us as members, us as a county eventually, and the county assembly passed it with development? Is that vision still there, or will it disappear when it goes to central government? Or we have other donor? Central government is not the only donor. And why can the people of Kakamega be a bit different and handle our issues? We have a budget of 10, 11, 12 billion a year. We have a population of about 2 million people. The biggest. I'm just giving them the facts so that they can analyze it and decide the way to go. Kenyatta National Hospital was built for over 10 years. The time Kenyatta National Hospital was being built, there was no COVID. The time Kenyatta National Hospital was being built, the population of Kenya was 9 million. So why do we want to complete our project in less than 10 years amidst a pandemic? If you look at our budget of 10, 12 billion a year, are there mistakes you are making? You are building a level 6, you are building a level 5, another level 5, no, level 4. Was it? I know there's one in Mumias West, there's one in somewhere in Mishijaru. Now, you people in the county assembly, how will you be managing a budget where you're getting about 13 level 4s and you still have a budget for level 6? Is something go wrong somewhere? These are the questions you must ask yourself. Because already, Governor Paranya was the chairman of a project incepted. Already it's political, self-interest. If you do a project very well, you should be able to disengage yourself as the chairman. If you still want to get to chair a project that is accepted, and you are saying you're not going to get those, I'm sorry. This is a very serious. Let's be truthful to ourselves. Disengage politics from this matter. If the project was supposed to be properly incepted, then the current governor should not be the chair of that board. Conflict of interest. Yeah, I've been a very good friend. So people in the county assembly, I agree with the chairman's position, this position, that we need funding if you want to move it very fast. But you can also move it on our own accord if we budget properly. Where the chair of county assembly helped. I always disagree with him. When I was lecturer, I disagreed with him many times, and he knows why. These are the things. We can actually finish this project as a county if we organize ourselves properly. Number two, the stakeholders. We are stakeholders here. Our sentiment should be taken over by Waziri and before them. There are so many stakeholders in this world. One of the major ones is the university. The university, for clarity, the university is supposed to be universal. In terms of the word universal, it's for the whole world. Eh? So we have a benefit to have Masinde Muliro with us. And kuna mikataba tumesaini na Masinde Muliro kama county na kama hospitali. Moi Teaching and Referral Hospital where I am, hizo buildings zote serikali, ile building serikali kijenga, ile ilikuwa against hospital, worse than our level 5, worse than our level 5. Chandaria ilijengwa na Chandaria. Pale kuna cancer center ilijengwa na Chandaria. Shoe for Africa ikajenga pediatric unit ndani ya 200 na theaters kama 10. Sasa central government si mbaya, lakini wale hao wenyewe ambao wanaweza kusaidia akiangalia pengine is there possibility of self interest again in that one? Ujiulize, mimi watu wa Kakamega. Ujiulize. Open is my friend, but we must open up so that we make the right decision to save ourselves.
That looks summarized.
So, Yamisho, let's be open about the costs at various stages. Pale hospitali imefika ni hospitali. Ilikuwa na phase 3. Waziri mtaka kuambia. Phase ya kwanza is the main hospital. Phase 2 are theaters and wards. Phase 3 are lecture halls. Why do you want to give out your hospital when you are about to finish it? Simple agenda, lakini just be rational on how you are using it and what you keep for yourself. And number 3, what are the lost opportunities for you people in Kakamega when you release the central government? What are your stakes? What do you want on the board? What do you want in terms of opportunities for tenders, etc., etc.? And those politicians are here, they're not talking. Then,
Daktari, utafupisha ndio tupate time bila kusponsor.
Then, nafupisha, just one sentence. Said the stakeholders are many. As I've just told you, Chandaria built cancer center. Show for Africa that they built a world fully fledged theaters. University here, I know there's a very big funding from the US for the Department of Health, the Faculty of Health here. You can join with the university, they can build for you a full unit. 2 billion shillings from American standing. Thank you.
It is good. I know the client very well. And again, fortunately, mimi nimekuwa lecturer Masinde University miaka 9. So I know Masinde University better than my friend Dr. Ben. Hata nyinyi mnajua. Hii Masinde University tunakopesha pesa 10 million ndio waanzishe health what? The health faculty. Watatujengea na ndio wanataka pesa kutoka kwa county government. Wala hapo daktari unadanganya. Sema tu kweli. And they are struggling even to pay salaries. Sasa wewe hata umeshindwa kujilisha. Wewe utalisha mimi kweli? Wacha tuseme tuambie wananchi ukweli. Now the idea of saying Oparanya is like, I did not say Oparanya must. Did I say must? No. Let us also use our English or understand the English word well. And I say so that we don't lose the focus, we don't lose the vision. And the third is good you are talking about the national government retain the same vision. That's why it has been suggested that to retain that vision, let the mwenye mwanzilishi afanye nini? And that is Uganda University, where I also went to school, Mugenda became the chairperson, the first chairperson. Right now, she's not there because tamu yake imeisha. But you were in the university, you never complained. Which interest did Mugenda have? The interest that is here. And that's why I pleaded with you. When my good friend here, Kidwake, will come to expound on that. Is the interest of the common man. Ukianza kuangalia ati mtu ako na interest, mtu ako na interest. Kwani kama mtu apataka kwanza last interest, kwani nyinyi mtakuwa mmekaa tu mnaangalia? Nyinyi wajinga. You will make noise. If you say let operator be the first person, the better even. You can still even have my former chairman was CGH to be the one, the chairperson, since he knows the vision of level 6. Tusidanganyane.
Nafikiri nimepata direction. Na nimeangalia book of the house. Maswali mingi tutatoka hapa saa 10. Kuna pia another forum inaingia hapa kazi yao. Na nataka niwaombe tuingie pale. Unless kama kuna swali mnakuchoma sana, naomba tuachie pale. Mzee naona umesumbuka sana. Acha tu hiyo mzao ulize, ukiona hali yako. Halo. Wajeni wao ulize swali yako. Nasema kupewa nafasi.
Kunipatia nafasi. Wananchi tafadhali msikilizeni. There is one issue which has not been dealt with in this discussion, and I want to bring it up. First, we have Commission for Revenue Allocation, which gave over the years billions of shillings to our government to use to develop infrastructure, everything to our people. The government has its own budget for developing its own medical infrastructure. You have taken the money which we would have used to build other institutions, other hospitals, and you put it there. Can we then ask the government to give us that money as it takes over that hospital? So that, let me finish, so that we can use that money to do so many hospitals like Shabu, which is stolen, and others.
I think that
Number two, let me finish. Number two, I am privy, I have read the 2022-23 proposed budget. There is no money set aside for Kakamega. And even in the projected 23-24, there is no projection. You are keeping up our hospital, which will just sit idle until maybe 2025-26 to be dealt with. I am opposed to transfer of this hospital. I'm requesting that we set up a more detailed committee made up of representatives from the sub-counties, a few members of the assembly and the government, so that we can review the whole issue properly before it is passed on. You are bullying us, you are pushing us in an issue which is not completely attended to. Please allow wananchi to take part in that decision. Thank you.
Okay, thank you so much, Mr. Machanja. Naanza na kujibu ile swali la mwisho. Budget, hakuna Kakamega being considered. Now, the reason why he public participation is because we have also been requested by the national government kujaribu kupeleka hii maneno kwa wananchi, waseme mambo yao iwepo kwa supplementary budget. If mutakata, then you can be sure that nothing will happen. It will be perhaps back again next financial year. Mukikubali mngojee supplementary budget, utasikia Kakamega level 6 has been factored in. I know you don't know that. Now you know. First question. Instead of there will be no refund by the national government after we hand over that facility. In any case, the national government is not carrying away the buildings. The buildings are remaining there. We are not giving away the land. We are only giving away the building, so that they run that building into now a facility that can offer medical services. What is the problem? Is it the level of understanding?
I think we are done with the issues of this motion. Na kama mtakuwa na maswali mengine pia inakubalika, mtaandika mahali. Kama utakuwa na mawazo yoyote ile utapata nafasi kuwasilisha hapa, you can write to the committee through our secretariat, and through then we shall be able to consider. Sawa. So tukapa vile nilivyosema mwanzo, we have a bill, the health services bill, and again I invite the legal officer to take us through this bill part by part. Tuwe makini.
Jambo litenda.
Natumai kwamba kila mmoja ako na kopi. Kopi ya bill, the health services bill. We have some copies here. Kama mna you can share, kuna zingine hapa pia. Can we be orderly, please? Ukiuliza swali unauliza tu mara moja na unatulia.
Kama bado napeana. Nilikuwa na maoni machache. Najaribu kwenda mbio.
Order please.
Najaribu kwenda mbio. Ndio kwa ajili nasikia kuna bili nyingine tena environment nafaa ikuje. Sema twende polepole. Tutachelewa. Watu wanatoka ni kuyani. Okay, ningeomba twende nyuma kwa memorandum and objects. Nyuma kabisa utaona memorandum and objects. Page 28. Nataka tupitie summary. Ndio tukipitia bila yenyewe tujue tunafanya nini. Naisoma. The Constitution of Kenya 2010, Article 186 provides for sharing of functions between national and county governments. Pursuant to this, the provision of health services will evolve as a function of county governments under the 4th schedule of the Constitution. The bill seeks to give effect to Article 43(1)(a) and Part 2, Paragraph 2 of the 4th schedule of the Constitution of Kenya. Provides for framework to allow the health facilities and public health units retain monies received and thus established an effective, efficient, and sustainable health care system to ensure provision of quality, affordable, and accessible health care services in the county. The bill provides for a framework which encompasses public and private institutions and skilled providers of health services at the county and facilitate in a progressive and equitable manner the highest attainable standards of health services at all levels of the community. It further provides a platform through which health rights of persons in the county will be protected, respected, promoted, and fulfilled for the realization of the highest attainable standard of health, including productive health care and right to emergency medical treatment in accordance with the Constitution, and recognizes the role of health regulatory bodies established under any written law. Lastly, it also provides for a health scheme that ensure all the residents of the county access quality health care from the facilities in pursuit of universal health coverage. That's technically the summary of what this bill entails to achieve once it passes.
Now we shall go back to page 4. We shall not read word by word the whole page. We shall just take the key areas and try to explain. If we read word by word as we always do, don't have us. Okay, the Kakamega County Health Services Bill 2021. I want to read the long title. A bill for an act of the County Assembly of Kakamega to give effect to Article 43(1)(n) and Part 2, Paragraph 2 of the First Schedule of the Constitution of Kenya, and to establish an effective, efficient, and sustainable healthcare system to ensure provision of quality, affordable, and accessible health care services in the county and for connected purposes. That's the long title. Now, Part 2, preliminary. The interpretation, the short title, the interpretation part. The short title, this bill may be settled at the Kakamega Kakamega County Health Services Act 2021. That will be the name of the bill once it's passed by the Assembly. The interpretation part, I will not read it. Those are just the definition of the words which you will encounter them in the bill. I'll go to the objects and purpose of the act. What are the objectives? The purpose of bringing this act? That's section 3, page 5. The objects and purpose of this act are to provide for a legal framework to regulate the provision of the highest attainable standards of health services at all levels up to the community. B, a framework to allow health facilities and public health units to raise, retain, and use monies received in accordance with section 109(2)(b) of the Public Finance Management Act 2023. C, to access to financial resources to health facilities for delivery of effective and quality health services. D, platform through which health rights of persons, including vulnerable persons in the county, shall be protected, respected, promoted, and fulfilled. And E, collaborative frameworks with other actors of the health sector. Part 2 it deals with the County Health Services Department. The county government shall, in furtherance of these functions assigned to it under Section 20 of the County of the Health Act, number 21 of 2017, be responsible for. Now we have the Section 20 of the Health Act provides certain functions to the county government. So these are other responsibilities. I don't think I'll read all of them. Now, I told you I'm picking up the important parts only. I wish we go to section 6, the next page. The level of funding for the Health Services Department shall be determined by the county government with the approval of the county assembly, but in any case, the budgetary allocation shall not be less than the amount last appropriated by the county assembly in the preceding financial year. Now we have classification of county health facilities. Those were some of the questions you asked Waziri. That is section 7. The county health facilities shall be classified as follows. A, level 5, county referral hospital. B, level 4, county and sub-county hospitals. C, level 3, health center. D, level 2, dispensary. E, level 1, community health unit. I believe Waziri explained all of them. Now we have section 8, establishment of a hospital management board. There is established a hospital management board to govern a county or sub-county hospital consisting of A, an executive chairperson appointed by the governor. B, The medical superintendent of the hospital shall be an ex-official member and the secretary. C, chief officer responsible for health services. D, chief officer responsible for finance. E, county attorney. F, sub-county administrator. G, one officer of the department cited by the executive member from among members of the county management team or sub-county health management team. H, one person representing faith-based organizations nominated by a joint forum of organizations in the county or sub-county. I, one person representing a governmental organization providing health services in the county or sub-county. Nominated by a joint forum of non-governmental organizations in the county or sub-county. J, one person representing persons with disabilities. Nominated by the joint forum of organization of persons with disabilities in the county or sub-county. One person nominated by a joint forum of health professional bodies in the county or sub-county from amongst their members who are not public officers. And I, one person nominated to represent the youth by organizations involved in provision of the health services in the county or sub-county. This is an all-inclusive list. The youth, persons with disabilities, faith organizations have been part of. I'll go straight to the functions of the board. Section 9 shall provide oversight over the administration of the hospital, promote the development of the hospital, approve plans and programs for implementing county health services in the hospital. D, approve estimates before submission to the executive committee member. E, mobilize resources for the hospital. F, prepare quarterly reports on the operations and administration of the facility and submit to the executive committee member in the prescribed format. And lastly, carry out any other function assigned by the executive committee member. That's the CCL. Now we have a management committee of a health center or dispensary. It shall be consisting of A, an executive chairperson appointed by the executive committee member. B, a ward administrator. C, the officer in charge of the facility shall be the secretary. D, one person representing the faith-based organizations or non-governmental organization providing health services in the ward nominated by the joint forum of the organizations. And lastly, E, two persons to represent the youth, persons with disability, and the public elected by local community members in accordance with the prescribed procedure. It's also an all-inclusive list. We shall go straight to part 3, that's page 10. Access to health care services. Section 13 provides for primary health care. The county government department shall ensure equitable access to comprehensive health and sanitation services. A, primary health care. B, emergency treatment. C, sexual and reproductive health services. And lastly, curative, preventive, and promotive health services for all the residents in the county. 14, access to maternal and newborn health care. The county department in this matter shall ensure the availability of a standard care and referral system, essential supplies and equipment, HIV prevention, detection and treatment services, contraception and family planning services, nutrition services and education, and lastly, any other related services. I think we shall go to part 4.
Hamjambo wote. Inaitwa Temba. Tutaenda part 4 which deals with public health. Kwa hii we have been told that the county government will ensure that public health facilities have progressive, they are actually which empower the data organizations, just to ensure that the public gets adequate and quality health services. The next thing is blood transfusion service. Currently, the county government has only one blood transfusion unit, which is situated at the CGH. And the county government has envisioned to have other satellite blood transfusion facilities, especially in the northern region, that is in Lukuyani, and the southern region, probably in Mumias or somewhere, so that to ensure that the patients have adequate blood whenever it is required. The other issue is control undertakings that sell food. That is basically the element of public health, to ensure that they regulate in terms of ensuring that they have licenses, enforcement of standards and guidelines. Hizi vibanda ambazo tunakula chakula, hata sisi as county government staff workers tunakula kwa hizo vibanda. So as the county government Ministry of Health has to ensure that the services offered are up to standard and there is adequate cleanliness. Sawa. Then there is the element of refuse removal, dump, and solid waste disposal. This is very key within our homes, where we stay, within the town, and even within the offices, where the government offices. The county government has to ensure that there is proper refuse disposal, especially within the town, just to ensure that hakuna taka all over. The county government has generally tried in that. Senior, we do not have litter all around the town and all that. So this bill will ensure that our county, both within our villages, community areas, town, and everywhere else, municipalities, there is cleanliness when it comes to disposal of refuse and all that. I'll go to part 5. There's promotion of public health. Public health is a very key element when it comes to health. You know, most of the time we assume the element of public health because we imagine that nangoja niwe mgonjwa niende hospitalini. But if we consider the issue of public health, which starts with us at home, how do you take care of yourselves within those homes? Choo na kila kitu, utapata kwamba tutazuiliwa kupata yale magonjwa ambayo yanatufanya twende hospitalini, si ndio? So the Department of Health shall develop and implement measures to promote public health. This one include burden posed by communicable diseases. Mnajua hizi communicable diseases and neglected diseases. When in case serikali ensure that we don't get these diseases, they prevent wananchi kupata hayo magonjwa. Inamaanisha even our own facilities as a county, like the CGH and the workforce, will not be burdened by the issue of curative or treatment. Sawa. There's the element of promotion of nutrition. Nyumbani tunalisha aje lishe bora kwa watoto wetu na sisi wenyewe. Yanazuia magonjwa mengi kutukumba. Then the element of comprehensive program to advance reproductive health. We have talked about reproductive health for quite some time. Tuna hata ile inaitwa imarisha afya ya mama na mtoto, si ndio? We have talked so much of reproductive health, reduction of morbidity and mortality arising out of waterborne diseases. Unajua, some of us think that Kakamega County are not prone to waterborne diseases. I hope you are all aware that we are prone to that. Here, we have bilharzia, cholera, and all that. Because so the Ministry of Health has to ensure that our people are not prone to such. County capacity to address post transmission of diseases, this capacity building and health promotion, whereby we get the CHPs hold meetings within our wards just to educate us on various issues. There's building capacity also. Yes, when we move to community health services, it basically talks about the element of public health education. One is the watu ambao wanatutembelea. So this bill has touched on them that to ensure that the county government is going to formulate strategies and implement the policies to provide, to ensure that our CHPs are well catered also, that they are also able to provide the required services back to the citizens of Kakamega. We go to part 5. Part 5, this bill talks about mental health. Najua it's very important. In one way or another, ile tumeketi hapa. Kuna kila mtu ana uangalizi yake kidogo tu, si ndio? Kila mtu. So unaweza fikiria tunalazimu ni yule anatembea barabarani, lakini si yule, hata wewe we have mental disorders. So the county government has to ensure that we have better adequate funds and taken care of when it comes to the element of mental health. So basically, this bill will provision for that, and should also come up with a county mental health council. That council will have a county director of health services, which shall be the chairperson. Must have a medical practitioner, must have a nurse, one representative county education board, and then of alcoholic drinks, medical social workers,